tonight. We're just gonna wait just another minute or so to let people in, and then we will get started quickly. It's lovely to see some new faces, some old faces that I know very well. Welcome, welcome. And we will get started in a moment. We are recording this, and we will send out a recording afterwards. And we're also broadcasting live on the North Carolina Justice Center Facebook page. And Jen, if you could put a link to that in the chat for folks, that would be fantastic. Okay. Right. I am going to just get started with the intro so we can stay on time. Welcome, welcome everyone to 'Tis the Season to be COVID Conscious informational panel with Dr. Richard Watkins and Dr. Louise King, who are here to answer your questions about COVID and long COVID. I am Rebecca Cerise, the health policy advocate in the Health Advocacy Project of the North Carolina Justice Center. And I am joined tonight by my wonderful colleagues, Nicole Dozier, who is the director of the Health Advocacy Project, and Jen Sharp, who is our communication specialist. Just a quick overview of the Justice Center. The North Carolina Justice Center's mission is to eliminate poverty in North Carolina by ensuring that every household in the state has access to the resources, services, and fair treatment it needs to achieve economic security. We focus on several different issue areas: healthcare, workers' rights, consumer and housing, education, immigrant and refugee rights, and criminal justice. And we utilize several different strategies: litigation, advocacy, research, community engagement, and communications in order to do our work. By the way, there are going to be a lot of opportunities to participate in advocacy next year across all of our issue areas. So if you're not already, please sign up to get our emails, and I'll put that in the chat in a second. And we're so happy you were able to join us tonight, because if you are like me, you still have a lot of questions about where we are with COVID-19 and what we can do to continue to keep ourselves and our loved ones safe. Before I introduce the speakers, I want to just launch a quick little poll. Jen, if you can launch one of the polls, and let's see if, yes, do you or anyone you know have long COVID symptoms? Yes or no? And while we are having people do the poll, I will introduce our wonderful speakers. Dr. Richard Watkins earned his PhD from UNC Chapel Hill in 2014 in microbiology and immunology with a specialty in virology. His research focused on the factors that influence disease progression towards AIDS and HIV-infected patients. Prior to attending UNC, Dr. Watkins earned a BS in psychology with a minor in sociology from Fayetteville State University in 2007. He is now a vaccine field coordinator for the National Conference of Black Churches. He also serves as the director of membership and chapters for Sigma Chi, one of the oldest and largest scientific societies in the world. Dr. Louise King got her BA at UNC Chapel Hill and her MD from Harvard Medical School. She is an assistant professor of medicine at the UNC School of Medicine and is the co-director of the COVID Recovery Clinic, which evaluates and treats patients with long COVID. So as you can see, we have two powerhouses in the on the webinar tonight to answer all of our questions. And with that, we are definitely going to take questions. You can either put them in the chat or raise your hand later on and take yourself off mute after I call on you. But we're going to wait till after both presentations to do that. That way we can get as much information as possible out, and then we can answer the questions after. And for those of you who submitted questions in advance, I have gotten those to our speakers, so hopefully they will be addressing those in their remarks. And with that, I'm going to first turn it, we got our poll results. So yes, 31% know someone who has long COVID symptoms, but 11, so 69% don't. So that's a positive thing, because long COVID does not seem like something that any one of us want any part of. But we'll learn more from Dr. King in a little bit. So I'm going to now turn it over to my good friend, Dr. Richard Watkins.
Hey, thank you so much for putting this together, to all the organizers of this webinar. Thank you. Thank you for bringing me back. There's just a lot of questions as you travel and go about your daily life. You may be confused on where we are with the pandemic. You're in one setting and everyone is wearing masks. You're in another setting and then no one is wearing masks. We have to deal with the sociological implications of this pandemic. And we also have to deal with a bit uncertainty amongst many of your family members and friends. But let me just refresh people on just a few numbers, because I think these numbers are interesting. Since the beginning of this pandemic, here in this country, we have lost over 1 million lives. Just let that sink in, 1 million lives. Now, of those more than 1 million people, over 27,000 of those are North Carolinians. And you might think that, oh, that was back when we were in the pandemic. We're no longer in the pandemic. There are conversations about, when we were in the pandemic and now we're coming out of the pandemic. And I think that's a bit confusing, but let me just remind you that in North Carolina, just last week alone, according to the North Carolina Department of Health and Human Services COVID dashboard, we lost 24 people in North Carolina just last week alone. I think that's just really, really important, especially as we're all preparing ourselves to gather over the coming weeks and months, as many of us prepare to celebrate Thanksgiving and many of us prepare to celebrate Christmas and other holidays. But what we have seen is that this virus responds to human behavior. This virus jumps from person to person. So when you gather in groups, it increases the likelihood that the virus will be able to jump from an infected person to an uninfected person. But let's back up just a little bit. COVID-19 is a disease. It stands for coronavirus disease 2019, caused by the virus SARS-CoV-2, severe acute respiratory syndrome coronavirus 2. I had to lay that out because it's important. A lot of people say they tested positive for COVID-19. It's not completely true. You tested positive for the presence or indications of the presence of the virus that causes COVID-19, SARS-CoV-2. Now, SARS-CoV-2 is a member of a virus family known as coronaviruses. Now, what's interesting about coronaviruses, in particular SARS-CoV-2, is that they're able to jump from one species to another. Now, to my understanding, we don't know the origins of SARS-CoV-2, but other coronaviruses are capable of jumping from bats, for example, into another animal, and then into people. I say that because I want to make sure I highlight the fact that this virus is able to adapt to a wide variety of circumstances. And that capacity for adaptation makes it a little bit difficult to deal with. Our vaccine approach is always having to deal with this. So the virus is constantly changing as it moves from one person to another. And sometimes these changes give the virus an advantage, whether it's able to replicate faster or it makes it a little bit easier to spread from one person to another, or for vaccines, It's able to evade the immune response generated by our vaccine. So we're always playing a game of catch up. So our vaccines are very good. Many of our vaccines enter the body and deliver a message. That message contains instructions to the immune system on how to identify the virus that it may come into contact with. Once identified and properly prepared, the immune system can clear the virus from the body relatively quickly. See, in regards to dealing with the virus, the immune system has to be prepared. If not prepared, it has to get itself ready. But sometimes it can't get itself ready fast enough, and the virus causes a lot of damage in a person and ultimately results to development of COVID and hospitalization, in severe cases, even death. So we're working very, very hard to make sure we prepare our immune system for the virus that it might come into contact with, which is why the vaccines had to be updated to provide immunity for the variants that are emerging. However, we need a lot of help. We need new vaccines able to deal with a wide variety of coronaviruses, a wide variety of SARS-CoV-2 variants specifically. And we need a vaccine that lasts a very long time. Those two things are what stands in the way of completely controlling this pandemic. Short of that, we have to protect ourselves. Right now, we are experiencing a flu season, many say for the first time in maybe 2 years, because many of us were separated and masked up. We're seeing an increase in respiratory syncytial virus, or RSV, in young children. And still, we're having to deal with SARS-CoV-2, the virus that causes COVID-19, as we're all preparing to eat turkey and dressing and stuffing. So you might want to know, well, what can I do to protect myself? I have been vaccinated, boosted, and I have taken the most recent boost that is providing my body with protection against these variants. I just want to remind you, every time you gather, it's a risk. The more times you gather, the greater the risk. And if you gather without a mask, that too increases the risk. So what I would urge everyone to do is to realize when you go to gatherings that you are putting yourself at risk. I am not saying don't. I'm not saying that. But just recognize that that is what is happening. And that just last week, 24 North Carolinians lost their lives to COVID-19. When you're in public spaces, don't be afraid to wear a mask. I say don't be afraid because you wearing a mask oftentimes provides validation to others who would also like to wear a mask. And you'll notice that if you're in a space often where no one's wearing a mask and you're the only one that's wearing a mask, people might come up to you and say, oh, should I be wearing a mask? Because they have their mask with them and they need that social support required to wear a mask. Because it's quite difficult if you're the only person in a crowd wearing a mask. So support each other. If you see somebody wearing a mask and you want to wear a mask too, go ahead and put yours on. And you'll start seeing throughout the crowd, more and more people will feel comfortable putting masks on. Yes, yes, yes. Still, at this point in the pandemic, years into it, I still have to remind people that masks are very useful. They prevent spit and other things from flying out your mouth when you talk, when you cough, when you sneeze, from landing on somebody else. And sometimes that spit can make somebody else sick. So protect yourself, protect those around you, get vaccinated, and please wear a mask when you're around large groups of people. I personally, I think that's also important to communicate what I personally do. I wear a mask all the time. In the workplace, when I'm out and about, even if I'm the only person wearing a mask, I will wear it. And I have to say, from anecdotal experience, I'm very pleased to announce that I haven't been sick in about over 2 years, whether it's the flu, whether it's anything else, because I'm wearing a mask. But knock on wood, that continues going. So I think at this point, I'm happy to pass it over to Dr. King to hear more about the clinical aspect of this. But if you have any questions, please put them into the chat. I know we're going to have a Q&A session later. I'm looking forward to your questions. But Rebecca, thank you so much for giving me this opportunity, this platform. I hope I provided useful information. But if there's anything I glossed over, anything that you want to know, please save it for the Q&A part. I'll be happy to answer those questions. Thank you, Rebecca.
Thank you, Richard. Dr. King?
Okay, well, it's a pleasure to be with you all this evening. As Rebecca said, I'm one of the co-directors of the UNC COVID Recovery Clinic. We get patients referred all over the state and all over the Southeast to us for persistent symptoms after having had COVID-19. And this is what we call long COVID. And it's emerged as one of the other big reasons to avoid getting COVID-19. We've gotten treatments for the initial COVID, which has helped with those symptoms, and the vaccines lower the symptoms, but there's still long COVID. And that's a big question for a lot of people. And many people's lives have been profoundly affected by long COVID. Long COVID, as far as our best estimates, probably affects about 10 to 20% of people who have had COVID-19. We think that more severe COVID-19 is more likely to result in long COVID, but even mild cases of COVID-19 can also cause persistent disabling symptoms. What is considered long after COVID-19? The CDC uses 4 weeks as the cutoff time, that after 4 weeks after having COVID, if you have persistent symptoms, and they call that post-COVID conditions. The World Health Organization uses a little bit longer timeline of 3 months. At our clinic, we use the 1 month marker, but we see patients who have had it since March of 2020. It's really impressive how long it can go on. And I'll address that towards the end of my talk. The symptoms are really so varied, and that's one of the frustrating things about long COVID. They can affect almost every organ system. And the general rule is that most people with long COVID have more than one set of symptoms. The most common symptom by far is fatigue. And when I'm doing a PowerPoint on this, like, I put fatigue in all caps because that's how patients describe it. Really bone breaking, not necessarily sleepy, but just really exhausted. A particular characteristic of this fatigue is something we call post-exertional malaise, which means that you try and push yourself a little bit, and then the next 2 or 3 days you're wiped out. Like maybe you go to the grocery store, or you try and do a workout, or you're busy doing something cognitively all day, and then you'll need a day or two to recover. And so we warn people about this, and it's very important to pace yourself. And to watch for this post-exertional malaise. And it challenges a lot of our usual ideas of like, well, just push yourself, and you'll get better. Because people can push themselves, and then they feel completely wiped out. The second most common symptom is feeling short of breath. So people notice that when they take walks, when they go up the stairs, or if you're a school teacher, for example, and you're reading a story to the school children, you notice that it's hard to catch your breath. And in fact, studies have shown that people with long COVID tend to take short, shallow breaths. And so one thing we do tell people is to practice breathing with your diaphragm and doing breathing exercises. And that's one thing that can help. But with difficulties breathing is seen very commonly. Similarly, having a cough that lingers afterwards is very common. Fortunately, the cough usually gets better. You might need an inhaler or some even over-the-counter cough treatments will help, or even honey and tea, those things may help too. One of the most disturbing symptoms is what we call brain fog or cognitive dysfunction. So people say that, for example, it's hard to follow a recipe now, or so it's the inability to follow a series of instructions, difficulty paying attention, what we call sort of executive dysfunction. So processing things is harder, and that's can be devastating for people. It does sometimes, many times it does improve, but it is one of the big mysteries of long COVID. And there's been a lot of research into it, even showing like MRI changes in people who have long COVID. Another disease entity that we see quite frequently in patients with long COVID is something called POTS, or with your heart rate goes up, so it's postural orthostatic tachycardia syndrome. And we think that, you know, in our bodies, we have a nervous system that's designed to be activated when you're under stress, and we call that fight or flight. So your heart rate goes up, you start sweating, you feel a little tremulous, you know, if you're nervous or if you're in a dangerous situation. And it seems that many patients, the system is activated and it's in overdrive inappropriately. So patients with this feel that their heart is racing, and we can measure that. That's one of the good things we can measure, and you can measure it too with a smartwatch, or if you know how to take a pulse, that you also can measure your heart rate. And we think that this is because the sympathetic, that adrenaline, is in overdrive. We've all heard about smell problems and people who have had COVID-19. For some people, this persists. So they smell, when they think they're, you know, supposed to smell coffee, it smells like garbage. And there's a medical term for it called parosmia, that you're smelling the wrong things. And I think some well-known chefs and cooks have been struck by this, which has been devastating for them. And they've come up with some interesting treatment strategies for smell retraining. So that's something else that we see. Other things really, we see a lot of dizziness, pain in different areas, chest pain. Furthermore, as we hear a lot of stories from patients, on the other extreme, there have been these large studies looking at electronic health records, those records where you see your doctor typing annoyingly during your visit. Turns out that they are actually good for collecting data. And so they've looked at, 9 million people, and they see that in addition, that after people have COVID-19, they're more likely to get diabetes, they're more likely to have high blood pressure, they're more likely to have a clot in their lung. So these are some other things that we see, and we might not necessarily see them in our clinic, but people notice them and are talking to their primary care doctor about them. For example, if you've had COVID-19 and you said, I never used to have high blood pressure and now my blood pressure is high, you're not imagining it. It might be an effect of the virus. Another general way maybe to look at the symptoms is that they can seem to almost cause like an aging process, that people feel cognitively and sometimes in their joints, like they've aged. And that's one of the theories, that the inflammation promotes an accelerated aging process in the body. I say all these conditions are really hard for people, and there's a huge sense of loss. Many patients will come in and they'll even show us pictures, because we're meeting for the first time, and they'll show us pictures like, this is what I was like before. And there's a big sense of loss. And sometimes that can lead to depression and anxiety. And that might be something else that you're feeling after you've had COVID-19. It's important to mention that to your doctor. I say that's often like a two-way street, that having depression or anxiety can increase your pain threshold, sort of lower your pain threshold, make you more sensitive to some symptoms. And it works the other way too, that some of these symptoms may increase your tendency to have depression. So it's important not to let that go untreated as well. So what's going on with long COVID? What is it? As Dr. Watkins was saying, we're always running after the COVID virus, and long COVID even more so. There are three main theories about long COVID. Muted me, there we go. One theory is that the virus is still hanging out, and maybe it's, somewhere in your body that is not detected, and maybe that's causing persistent symptoms. Other people think just the general inflammation that's caused by long COVID is wreaking havoc in the body. And a third theory is that the COVID virus triggers your own immune system, so that it's out of whack and it's attacking your body when it shouldn't. So what should you do if you have persistent symptoms after you've had COVID-19? As I said, that if you've had it for more than 4 weeks, that's when we consider that you might have a post-COVID condition. It may be helpful to keep a diary of your symptoms to see if there are any triggers. It's important to let your doctor know, because you may have another condition. Many of these symptoms are what we call non-specific, so it might be something else that's going on. Your doctor can run some tests to make sure that you're not missing something else and just attributing it to effects of COVID. I do have to say that if you see your doctor for long COVID, you may find that many of the tests that they run are normal, and this is very frustrating. Some of them may come back abnormal, the heart rate might be high, but it doesn't mean that you don't have anything. It just means we're not looking probably at the right biomarkers. Unfortunately, there's not a single test for long COVID. We look at the general symptoms and the setting, and we make sure it's nothing else. And we look at what we know are common symptoms, like the fatigue and the fast heart rate, but knowing that there's a wide range of symptoms, and that's when we decide that you might have long COVID. Other things that can be helpful are eating healthfully. Some people call this like an anti-inflammatory diet, or we call it the Mediterranean diet, where you decrease processed foods, you focus on omega-3 fatty acids, you use oils like olive oil, and some people have found that helpful. Make sure that you're getting good sleep. COVID-19 initially and in the long term can make your sleep out of whack. So make sure that you're practicing what we call good sleep hygiene. Make sure you're not drinking too much caffeine. Even if you don't feel like exercising, try to get some sun, so it sets your clock in a good way. Breathing exercises may be helpful, and I put some of those in the resources. Those can help with that sense of difficulty getting your breath. They can also help with your sense of anxiety, and may help also lower your heart rate if that's one of your symptoms. How can I prevent getting long COVID? Well, the first thing is don't get it, is try not to get in the first place. And Dr. Watkins mentioned some of those. So get a vaccine, wear your mask, especially in crowded places among people that you don't know. If avoid people who are sick, and if we're sick, don't go around other people. And let me spend a moment just on the vaccine itself. So even if we all know stories of people who got the vaccine and got COVID, it's unfortunately more common than we had hoped. But it does seem that in those what we call breakthrough cases, that those people are also less likely to get long COVID. It's probably because long COVID is somewhat linked to the severity, and that having the vaccine usually means that your case of COVID-19 is less severe. And it does seem to decrease the likelihood that you'll have long COVID. Another thing that might be helpful is, this is very new, just in the last couple of weeks, a study came out that suggests, we don't have a real sophisticated in-depth trial, but it suggests that people who took Paxilvid when they had COVID were about 26% less likely to have long COVID. And again, this is one looking at the electronic health records. They looked at all the people who got Paxilvid and then followed them out and compared to the people who didn't, and they were less likely to get long COVID. We haven't done the trial yet where we really randomize people to Paxilvid or not and follow them out, but it is suggestive. And again, to me, it makes sense because Paxilvid tends to decrease the severity of COVID-19. Someone asked a question, which was about, what about chronic fatigue syndrome? What's the relationship between chronic fatigue syndrome and long COVID? Chronic fatigue syndrome is also called now myalgic encephalomyelitis / chronic fatigue syndrome. And it's been around a while. It has traditionally been attributed to Epstein-Barr virus. It has been met with mixed reception in the scientific community. And but there are many of the same symptoms as long COVID, and I don't think it's a coincidence. And I do think that there seems to be a post-viral syndrome, and many of them same mechanisms may be playing. As for example, that post-exertional malaise is often found in chronic fatigue syndrome, as well as that POT syndrome that I talked about, where the heart rate goes up, can also be seen in chronic fatigue syndrome. We're hoping that studying long COVID is going to help us better understand chronic fatigue syndrome. And the NIH has a very large study out called Recover, and it's available on the internet if you're interested in participating with it. They also have a lot of good webinars on long COVID, but we're hoping that some of the research will help us understand and treat long COVID as well as chronic fatigue syndrome. Someone asked too, well, what about children? And I have to say, our clinic doesn't see children. Long COVID is definitely less common in children, but definitely occurs. And what's noticed, I think, especially is the cognitive things, not being able to process as much, and the fatigue. But it is less common, but it does occur. There's also the really unusual it's called MISC, multisystem inflammatory syndrome, that children can get who've had long COVID. I'll have to say that, many of you said that some people who have long COVID, and I would say that if you have a family member or friend who have long COVID, realize that they'll need a lot of support, and that I think it can be frustrating for people because it's hard for them to work, it's hard for them to do things, and they may need extra support. So I'd say in summary that long COVID is common, occurring, in probably 10 to 20% of the people. It's still poorly understood, but we're researching it. If you have symptoms, that you feel different after COVID, you're not imagining it, and make sure that you get the rest that you need, and to eat healthfully, and to address these things with your doctor. And I'm happy to take any questions. I remember someone had a question about headaches, and in headaches, we definitely see a lot of headaches after COVID-19. Similarly, people who have had migraine headaches before COVID often notice that they become a lot worse. And many other conditions that people had before can get worse after COVID-19, like asthma, for example. The headaches do respond to some treatments, but it takes a little bit of trying a few different things, we found.
Dr. King, I just wanted to jump in really quick, and I just wanted to point out something that I was hoping to address in my portion, but you mentioned it, and I think it's a great time. You mentioned Paxilvid, and I just want to just tell everybody. So Paxilvid is an antiviral that is currently authorized for emergency use. And I just wanted to read this part directly from the Pfizer Paxilvid website, and I'm going to read it, verbatim, so the audience has it. So Paxilvid is investigational because it is still being studied. There is limited information about the safety and effectiveness of using Paxilvid to treat people with mild to moderate COVID-19. So I just think that's important for folks to know. So Paxilvid is an antiviral. Most of what we often talk about are vaccines. So vaccines help your body generate antibodies to help thwart a viral infection. Antivirals interrupt a particular event in the viral life cycle. And so those are the two categories that we've been talking about, but you mentioned it, I just want to bring it up.
Yeah, it's a big thing. I say it's especially useful for people over 65, especially beneficial for people over 65, as what the studies are showing now. So yeah, my other hat is a primary care doctor, and so I prescribe a lot of Paxilvid. The main side effects we've seen are a funny taste and a little bit of nausea. So it's a new tool out there, and I think it's useful, but it's another way we're chasing after the COVID virus.
Thank you so much. Before I get to some of the questions from audience that have put some in the chat, I have a question, which is stepping back from long COVID just to COVID, because I don't know, I know this is a question I have. If you take a rapid test at home and find that you test positive for COVID, like can you, Dr. King or Dr. Watkins, talk about what happens from there? Like, is this something you should report somewhere? I'm thinking about potential later on disability claims potentially, so that you have things recorded. And then when is a time to go seek medical help? What are some, besides what you just mentioned, are there other things out there that are being used? How do you know whether to ask for those things? Like that sort of thing, sort of like an overview of what happens if you test positive from there.
Okay. Yeah, so I think that's an excellent question. I would say to first, it's to let your doctor know, and they can document that. Things are changing so much that uh, maybe, you know, in a few weeks there might be a new treatment or new guidelines, and then they can tell you, for example, oh, you have COVID now, wait 3 months before you get the vaccine. And your perception of your risk may be different than your doctor's perception of your risk. So it's always good to ask. And I think that usually, like most people, you know, after a few days, you're supposed to mask and stay inside for 5 days, and then for another 5 days to wear masks. And probably Dr. Watkins would tell us more about that. But I say to let your doctor know. And what if you're listening to this and you don't have a primary care doctor? And sometimes it'd be hard to get in with a primary care doctor, or you've moved. I would say to, you know, if you have any issues of trouble breathing or a cough that won't go away, or you're feeling weak or you can't eat, and then that's a time where you might want to, you know, consider going to an urgent care or even emergency room if you're feeling that sick. But regardless of how you feel, if you can, I would advise you to let your doctor know about it.
Yeah, this is a very good question. So I agree with all that what Dr. King said. I do think it's important to notify people that you've been around. Employers are a good starting place. Notify your supervisor. If you yourself are the supervisor, then notify your employees. I think that's important. You know, trying to stay ahead of it is a really good thing, but I would like to just kind of notify individuals that you may not always know whether or not you are infected with SARS-CoV-2. Often, what prompts testing is preparation for a large gathering, often some travel. You have to show proof of a negative test. But outside of that, many people get tested once they start feeling symptoms. And having symptoms is not always a prerequisite for having the infection. And so it's a bit complicated, and it is tricky. But I would say that when you do test positive, you know, contact your healthcare provider, contact family and friends that you know you've been around over the past week, I'd say, and also make sure your employer knows, especially if you work in close contact, because it would give your colleagues an opportunity to be on the lookout for symptoms, prepare for it. And I mean, if you have the flexibility, I have to acknowledge not all employees have the flexibility to work from home. But if you do have the flexibility to work from home, please do so. If you have symptoms or if you test positive for SARS-CoV-2, the virus that causes COVID-19, that would be my recommendation.
Yeah.
I got a question from one of our audience members. I just read today that the new COVID vaccine is no longer covering the latest variants, the bivalent that just came out. Can anyone speak to that?
Yeah, so this is what I really wanted to kind of touch on. I think we're in a tough situation. I'd like to remind folks that, to my understanding, there has only been one virus that has been eradicated from the world, and that is smallpox. A virus that we have been close to eradicating from the world is polio. So this process of getting rid of the pandemic and getting rid of the virus is a tough one. And the virus is always changing. So our vaccine approach is to train our immune system to recognize a particular portion of the virus called the spike protein. Over time, that protein changes. So say, for instance, you are out and about and you're looking for a person, right? But the longer you take to find and locate that person, the more likely it is that that person's face will change. I know this sounds strange, but that person's face will change. And so, given enough time, when you come into contact with that person, you may no longer be able to recognize that person because their face has changed so much. And that's what's happening with the virus and the immunity that comes from the vaccines, is that the virus changes over time, and the immunity that you get from the vaccines is no longer as good at recognizing the new version of the virus. So I just want to kind of go back and kind of use a term, is that we're always playing this game of catch up, and the virus is always steps ahead of us because it's under that pressure to change and to find a very successful environment for itself. And so it'll continue to change. It's hard to predict exactly what those changes, what advantage those changes will give to the virus. It's hard to say right now, but yeah, the virus is continuing changing. I think a week, or maybe not, a month or 2 months ago, the White House had a meeting that I was able to attend virtually regarding the next generation of vaccines. And that was really the focus, is making sure that we have vaccines that elicit immunity for a longer period of time, but more importantly, vaccines that generate an immunity capable of recognizing a wide variety of variants or versions of the virus. But right now, it's very difficult, and the virus, as it jumps from one person to another, will continue to change over time. So hopefully I addressed the question of being asked. And if I didn't, for the person who asked it, please let me know if I need to clarify on a particular point.
Thank you so much. Another question, are there limited quantities of the antivirals?
It doesn't seem that there are, and many experts feel that it's being underprescribed. So it seems to be plenty available.
Okay, underprescribed. Okay, is that something that people, could ask about, or that you suggest they advocate for themselves if they are, pretty sick and, would it be in a hospital setting only, or could your primary care?
Oh yeah, even the primary care doctor can, although it's especially beneficial for people over 65. So I'd say if you're over 65, under 65, I don't know how much benefit is proven. And then I think a lot of people have been wary because of the rebound after Paxilvid, made famous by President Biden. And the number, it seems maybe more that people talk about it more than it happens, but definitely happens. Probably about 10 to 12% of people will have persistence, and maybe it's just not a long enough course, but no one is saying that you should take it for longer, just that you isolate again for 5 days, an additional 5 days. But it is true that you can get rebound, but probably not as common as it's reported to be. And it usually tends to be very mild, that second wave.
And Dr. King, by rebound, I think I know what you mean, but by rebound, you mean symptoms go away for some period of time. You can't see virus in the body, but then all of a sudden, after a period of time, symptoms and the virus comes back. Is that correct?
Yeah, exactly.
Thank you for that. Another question from Sadie Rapp. Do you all know anything about improved rapid test options? It feels like it's been a long time since antigen tests have been more accurate. Like since Omicron emerged last fall, winter, we have improvement in vaccines to target new variants, but it feels like home testing has not really improved. Seems like that could be incredibly helpful to prevent casual exposure during the holidays, that it is so much faster and more accessible than PCR tests. Amen to that.
Yeah, Dr. Watkins, do you want to answer that one?
So I actually don't know about the availability or the planned distribution of at-home testing kits. Yeah, I don't know the answer to that question. I apologize.
Yeah, I don't think there's anything too new on the horizon for home test. I do think they're useful. They're not perfect, but they're available. And I don't think you can get them free anymore, but I think the insurance is still covering it. But I'm not 100% sure on that. I know someone asked that question. I'll give a shout out to UNC because we have a really great test. Now, if you come and you get, if you come to us, you get tested for the flu and the COVID and RSV viruses, and we know the answer in about 2 or 3 hours.
All right, so
Yeah.
UNC, plug for you. Sorry, Richard, go ahead.
Oh, well, then all I was going to say, though, is that how do I best put this? Sometimes it's still hard on a practical level to still make decisions based on testing, right? Like, when should I test? Some tests are better once symptoms are present. It's just still, I think testing is great. We use testing anytime you see symptoms. But I feel like sometimes at the clinical setting, having a test done is just a little bit different than at home testing. I still think testing needs to be made available. But I just would like to defend people who are testing and doing all they can, but still have a hard time making a decision like what should or shouldn't they do? Are my symptoms severe? Is this a false negative? Like, am I, it's still very, very difficult at home to determine, because I know in the clinic, you can test somebody and they're negative and they're still like, well, you might want to test again. And Dr. King, when you see like testing in the clinic and for clinicians, administering the test, how confident are they when they see a negative test with a patient to kind of say, hey, this is what's going on? Or do you see more of the time like, hey, you might want to come in and get another test? What are you saying?
We often will have people repeat them. Even just repeating the home test like in a day, don't hesitate to repeat it. That's right. So, and we're seeing a lot of flu and RSV out there too. So, and it could be one of those as well. But yeah, I think frequent testing is helpful.
And it would be really helpful if they were still free and readily available in that way, which is one of my frustrations. I mean, just from a public health perspective, it just doesn't seem like a sound policy to not have these, tests available, as flawed as they can be, to people. Little rant there. Okay, another question. I understand that even after symptoms are gone, you might continue to test positive for COVID-19, but you're no longer contagious. Is that correct? I recovered, quarantine, and was feeling fine, but still tested positive. When I called my doctor, she thought that I might continue to test positive, but that I wasn't contagious.
So, that's kind of like a gray area, because kind of the question is, are symptoms related to the spread or just having virus related to the spread? And so a lot of people say it may be symptoms. Some people say it's maybe virus. I will say that if you are infected, then you can still spread that infection to other people. The absence of symptoms may make it harder for the virus to be transmitted to someone else. For instance, a symptom can be a cough. The process of coughing is just a means for the virus to be transmitted from one person to another, right? So what I would say, in my opinion, that if you test positive, then you can still transmit. But your primary care provider might be looking more at your symptoms. And in the absence of symptoms, they might then say, it's not likely that you'll transmit the virus that we are detecting because you lack those symptoms. But I would say anybody who's positive can transmit it. It's just that the likelihood of transmission might not be as high in the absence of symptoms.
Thank you for that. Did you have anything to add, Dr. King?
Yeah, I agree. I think the CDC, like, retesting is not currently, suggested, though. If you do test positive, I believe the CDC says to keep masking for another 5 days.
Okay, thank you. Richard, for you, there was a follow-up about the vaccine question earlier on. The person is worried that the vaccine they just took is not effective. Is that what you're saying? Or because the virus is, sort of always ahead? Or are you still saying that it can be effective, but it's just not, foolproof type of thing?
I'd say the latter. It's still effective, but it's not foolproof. From my observations, nothing is foolproof. That's just what I've seen. And just keep in mind, this virus, it is perfectly designed to spread from one person to another, right? It has the capacity to adapt to its circumstances if pressure is applied to it. And that's just not this virus. That's literally every virus that we are still dealing with. The reason why we are dealing with viruses of any kind is that they were successful at adapting to pressures to allow itself to still do something, right? So it's like with any kind of like updated thing, right? So the new vaccine that provides instructions for variations in the spike protein allow your immune system to recognize those things. The problem is the virus is maybe 2 or 3 steps down the road. Now you're still dealing with something that can still make you sick and kill you, right? So it is still effective and it's still important to get vaccinated. But no, it's not foolproof. And yes, the virus is constantly changing. And I think this conversation is incredibly important because the lessons that we are able to learn now about viruses and about immunity is probably more than anybody planned on realizing or learning, right? But this will not be, so this pandemic, in my opinion, is not over. And this will not be our last pandemic, right? We will have to deal with another pandemic in our lifetime. And so it's important to really understand that viruses change. Some viruses have a higher capacity to change than others, such as influenza. Influenza is an amazing shapeshifter. That's probably not the best way to say it, but it changes very, very quickly. It too is a virus that is able to jump from one species to another. So influenza, its original host are marine birds. And in marine birds, it replicates in their stomach. But in people, obviously, it causes respiratory distress. So these viruses, they continue to change. And the vaccine, the vaccine will too have to constantly change unless you create a vaccine that generates an immunity that is able to recognize and identify and eliminate the virus, no matter what new mask the virus puts on. Hopefully that made sense. I hope I explained that okay.
Another question about the vaccine. After the vaccine, how many weeks till peak immunity, and what is the trajectory? How many weeks or months at various percentages of protection in terms of the current vaccine?
So everybody's immune response is different, but you can expect peak protection, if that's a thing, to be seen roughly 10 to 14 days following vaccination. How long the immunity lasts is still up for debate. Some suggest as long as maybe a year, others suggest short as 6 months. And so that's just the effectiveness of the immunity that it's supposed to be generated towards, right? I'm not even talking about new variants, right? So again, I just want to go back and restate what I said. So following vaccination, right? Your body needs time to ramp up. It doesn't do it instantaneously. That happens over the course of several days. Maximum can be seen 10 to 14 days, but it varies depending from one individual to the next. Now, from there, how long does that immunity last? It could last from a year. It could last 6 months. The jury is still out. We do know, however, that it does not last your lifetime. And we also know that the virus continues to change. So we will have to continue to revamp and redesign our vaccines. Now, at this point, I do have to check in with my clinical partner up here. Did I get that right, Dr. King? And if I didn't, please correct the record.
Well, I think, no, I completely agree that, that 10 to 14 days will be when you can expect it to be effective, and keep that in mind if you're going to be having a big family get together. Don't wait till the day before to get vaccinated. Get it. And I think we'll just see as time with how the virus changes and how long it will last.
Thank you so much. Quick question about masks. Is there, masks that are more effective than others?
Yeah, so now I'm going way back. I know there's probably been more investigations done, but I have to put out, even though I was trained at University of North Carolina at Chapel Hill, the study that I'm about to reference comes from Duke. And so they were able to look at a wide variety of mask or face coverings and compare them. And the experiment, I think, is they measured the amount of particles that were able to pass through the mask. And if my memory serves me correctly, your N95s were the best. And all of them, with one exception, I'm going to go to that, all of them, according to this particular investigation, reduce the number of particles that pass through. With the exception of, I think they're called gaiters. They're just like sleeves that kind of come over your mouth and mask. And they only look at maybe a particular brand, so they can't say all gaiters are like this. But in this investigation, the gaiters actually increased the number of particles that come out of your mouth. And you're like, wait, how is that even possible? Well, what they suggest in the discussion is that you have particles that are coming out of your mouth at various sizes, right? In some masks, those particles just stick and stop. But for some reason, in the gator mask, they go through and they're just like broken up into more pieces and go through. So yes, face coverings are good across the board. With the exception of the thing that I just described in this study, all right? And N95s are great, but surgical masks, N95s, proper face coverings, I mean, those are all really good, but I wear an N95, and I think one of them is like how long they should be used. These are disposable masks. I know practically people are wearing masks and reusing masks. I mean, we're not made out of money. We don't have like all this money, and so people are re-wearing masks. I'm going to go ahead and raise my hand. I re-wear my mask sometimes, just being honest with you. But they are actually intended to be worn, disposable mask, I believe, one time, especially your surgical mask, which are your kind of, they're like blue on one side and they loop around the ears. I believe those are only to be worn one time. But yeah, to answer your question, wear a mask. All masks prevent, but to different degrees. And I believe the evidence supports that the N95 mask is the best mask to purchase to wear for normal everyday use to protect yourself.
Thank you. Once again, these should be available at very low charge or no charge at all. If we actually were focused on keeping people healthy and it from a public, dealing with this from a public health perspective. And it's just one of the very frustrating things about our healthcare system in general, that's so based in profit. I just know that in other countries, like their rapid tests were free way longer than ours has been. Or very low. I mean, I know that before they were giving the, sending the free tests, I would have to, and 2 tests was $25 at, Walgreens. That is a lot of money. And that's for because especially like Dr. King, what you were saying, if you test positive or even if you test negative, you're supposed to test like 24 to 36 hours later just to double check. So the 2 tests really are supposed to, I mean, according to the instructions, be used together. And yet that's a lot of money for people. And so it's really frustrating. And masks are not cheap either, especially the N95 masks. I bought some for my trip overseas that I just took, and like 20 masks was like, I think it was like $25 or $30. Again, this is not something that a lot of people can afford. And it's just really frustrating that we don't seem to be caring as a country about people that don't have the resources to stay healthy and to stay safe. Any other questions? One here that says, does COVID show up in other types of normal yearly blood work? As far as I can know, COVID does not show up in blood work. Is that correct?
So yes, you can see COVID in blood work. I don't know how you would define normal, but say, for instance, one of the early ways that people would see if they have had contact with the virus is when they go give blood. I don't know if that's what somebody would call normal blood work, but they would look for the presence of antibodies. And antibodies doesn't necessarily say you're currently infected. It says that you have been infected and your body still has those antibodies available. So yes, there are ways to detect the presence or the history of the presence of the virus via blood work. It can also be determined via water samples. Obviously, you've got your nose and throat swabs. I might be missing something, but yeah, there's a wide variety of ways that SARS-CoV-2 can be detected.
I think this person was thinking about yearly physical, like normal blood work. Is this something that would have to be specifically looked for? Yes, no.
Yeah, I would say, yeah. I think one thing I would say is if you've had COVID, you make sure you get that yearly physical, just because I mentioned that some other things are more common after you've had COVID, like diabetes, high blood pressure. Of course, people get those all the time anyway, so it's hard to know. But as there's no, one blood test for long COVID, and you can check for antibodies, like Dr. Watkins said, but sometimes those antibodies trail off with time.
All right. Any questions on Facebook, Jen? Okay, no. And I did want to point out that, oh, hang on, we did get one. Can an antibody test give any insight into your likelihood of contracting COVID in the near future, like showing how on guard your immune system is?
That's an interesting question. Yeah, I don't know. I don't want to go out on a limb. That's a really interesting question. I haven't, I actually haven't looked at like, so some people will look at antibody titers, right? So how much antibody you have. And that's what we were talking about giving your immune system 10 to 14 days. So there is this awareness and acknowledgement of how much antibody you have and its ability to thwart manifestations of COVID or symptoms related to COVID. That is true, but I haven't necessarily really thought about, pulling blood and then somebody looking at your blood and like, oh, you've got this much antibodies. We can then quantify your likelihood of developing COVID. I'm not necessarily aware of that because, for example, not all antibodies that you're going to produce is going to be able to neutralize the virus to the same level. So that's a really tough question because I don't know what the target of the antibodies are that you're randomly seeing. Yeah, I'm just in a long-winded way to say I don't know. so I was just trying to walk you all through my thought process, but overall, I do want to say I don't know.
All right, one last one. Does wearing 2 masks help? Does that make any difference if you're doubling up on masks?
I think the CDC says it can help, I think. Yeah, actually.
Yeah, well, it's just
a little uncomfortable.
It is uncomfortable. It's hard to breathe because the air is taking a longer time to pass through 2 layers, but it does make it harder for a particle that makes it through one mask to then make it through the next mask. So I think that's some of the thought there.
Okay. I want to thank both of you so much, Dr. King, Dr. Watkins, for sharing this information with us. This has been something I've wanted to do for a very long time because I just feel that the media has really, dropped the ball on this. It's no longer the big news. And like Andy wrote in the chat, that's not in the news anymore. And that's why people are more comfortable with thinking that it's over. Plus we want it to be over very badly. And we want to not have to wear a mask and not socially distance and not worry about getting our loved ones sick, and things like that. But thank you so much for sharing your information with us. I hope it was informational for others on the call as well. We do have it on Facebook. We're going to also put it up on our YouTube page. I'm going to email it out to everybody that registered. What are the best websites for up-to-date information? That's a very good question. Any insight into that, Dr. King, Dr. Watkins?
I put something in, so there's something called Stat News that has some science news. If you're on Twitter, like Med Twitter is a big thing. I won't make any, I know Twitter has a new head, but actually Eric Topol has a Substack, and he's I think his background is actually cardiology, but he's really quite good. And Bob Wachter is the head of infectious disease at UCSF. And he has these really nice things on Twitter. Like he says, this is what I'm doing, and this is what I'm looking at. And I think his advice is very practical.
So all the information that you heard from me today, here are the places. So early on, I gave numbers as far as deaths. That comes from the Bloomberg COVID cases and deaths tracker. I sometimes include vaccination information that comes from the Bloomberg vaccine tracker. I gave information specific to North Carolina cases that comes from the North Carolina Department of Health and Human Services COVID dashboard. The information I provided on Paxilvid comes from the actual Pfizer Paxilvid website. So those are some of the resources that the information that I provided come from.
Can you send those to me so I can put them on the resource page for folks when I send out the email, Richard? Wonderful. Well, thank you, everyone. I hope that everyone has a safe, healthy holiday season. I hope this was helpful. And I hope that you will, and I know a lot of you on the call will join us in our fight for healthcare justice, because our healthcare system is definitely not where it needs to be. And on top of our very important fight to expand Medicaid in North Carolina, we have to think bigger, and we really have to go towards a not profit-based universal single payer healthcare system where all of us can actually see a doctor. I mean, we heard from Dr. King how important it is to have a primary care physician, but like she also mentioned, many people are not lucky enough to have that because they can't afford it. They don't have insurance for whatever reason. There's so many different things, and it's just in the richest country in the world, it does not have to be that way, and it shouldn't be that way. So we hope you will join us in our advocacy fights moving forward. And thank you all so much for joining us tonight. Have a good one.